'Twas the week before Christmas, and all through the NHS in England, resident doctors will be doing this. It was confirmed today their strike will go ahead at a time when NHS leaders say they need all hands on deck. Earlier this month, ITV News broadcast this footage showing patients left in corridors as the health service struggles with winter pressures. With flu cases at a record level for this time of year, the Health Secretary says the decision to strike is irresponsible and dangerous.
The fact they are choosing to strike this week at a time to inflict maximum damage on the NHS, but also at a risk of serious harm to patients, I think is unconscionable.
Resident doctors, formerly known as junior doctors, have received pay rises of nearly 30% in the past 3 years, but the BMA wants a further 26% rise over the next few years. The government's latest offer included legislation to prioritise UK medical graduates for training places to tackle the job shortage and funding to cover the cost of exam fees. But that wasn't enough.
It clearly doesn't go far enough to fix this jobs crisis with just repurposed jobs, and also it doesn't do anything to address the long-term pay erosion that doctors have faced in the face of yet more real terms pay cuts that this government is pushing onto us.
So the 5-day walkout will begin on Wednesday morning. NHS leaders fear patients will be more than disrupted.
Patients, I'm sorry to say, are going to come to harm, and the NHS is going to be damaged. And we had so hoped that the government's offer from last week was at least going to get to a pause in the industrial action, while everyone needs to deal with the huge increase in flu. And sadly, a chunk of the workforce, a really important part of the workforce, are not going to be at work.
This will be their 14th strike in recent years. Polling suggests the majority of the public no longer support their industrial action.
Well, Rebecca's here. A lot of people are going to be very worried about this, aren't they? What chance is there that it could actually be called off, do you think?
Well, I mean, the BMA insists that the strike is still entirely avoidable if the government presents a credible offer, but we're cutting it pretty fine. Their vote was definitive. 83% of BMA members voted to continue with this week's strike. There was a turnout of 65%. Today, the Prime Minister said that he was gutted at that result. He said that it was irresponsible, and he claims that the BMA is now losing the sympathy of the public and the support of their colleagues. A recent YouGov poll did suggest that 58% of the public now oppose this industrial action, and NHS staff are going to have to stand in for their colleagues in the days just before Christmas. Today, the Conservatives said that they repeatedly warned Labour that these inflation-busting pay rises would set a dangerous precedent. And today, the Shadow Health Secretary, Stuart Andrews, said that the Tories would ban doctors from going on strike.